Hi, I'm Sue Hopewell. I'm a tissue viability nurse at Tally. I'd like to introduce our pressure ulcer patient and caregiver leaflet. This leaflet has been designed with patients and caregivers in mind to provide information on pressure ulcers and how they can be prevented. I would also like to make you aware that there are graphic images shown during this video which some viewers may find upsetting. There are several topic areas covered in this leaflet which include who is at risk of developing a pressure ulcer, where pressure ulcers occur on the body, including how you can help to prevent them, plus much more as you can see. This leaflet also provides information about what to do if you develop a pressure ulcer and who you can ask for more information. So what are pressure ulcers? A pressure ulcer is an area of damage that occurs to the skin and underlying tissue. Damage usually happens when sitting or lying in a position for too long. They used to be called bed sores, but now they are referred to as pressure ulcers because they occur as a result of persistent, unrelieved pressure on the patient's skin and can occur in patients who sit for long periods without moving or repositioning, not just those who are bedbound. The skin and tissue damage may appear minor, but it may also develop into something more serious. Pressure ulcers are classified against a standard scale in terms of their severity, which you can see in the following illustrations and photographs, with Category 1 being superficial and Category 4 being a severe wound, which can penetrate down as deep as the muscle, tendon and bone. As you can imagine, pressure ulcers will cause additional pain and suffering for most patients, and they can slow down a patient's recovery and reduce their quality of life. In the very worst cases, patients can die as a consequence of developing a serious pressure ulcer because the damage to the skin can allow bacteria into the body, which can lead to serious life-threatening infections. So who is at risk? Well, anyone can develop a pressure ulcer, although the risk of developing one increases when you have problems moving and cannot change position in bed or in a chair without help, have poor circulation, have damp skin due to incontinence, sweating or a weeping wound, have had a pressure ulcer before, or are not eating a balanced diet or having enough to drink. Risk can also be increased if you have poor sensation or loss of feeling in parts of your body, for example after a stroke or spinal injury. If you are seriously ill or undergoing surgery, if you're elderly or very young, if you are obese or malnourished or underweight, or have memory problems. And also your risk can also be increased if you do not have a suitable pressure relieving mattress or cushion. So where do pressure ulcers occur on the body? Well, they normally occur over bony prominences, so where the bones are closest to the skin surface, such as the bottom, the hips, the heels and spine, etc. Pressure ulcers can also occur under essential medical equipment that you might have to use, for example an oxygen mask on your face or an anti-embolic stockings on your legs. If you're lying in bed or sitting in a chair for a long period of time without changing position and relieving the pressure, the weight of the body pressing down on the skin effectively stops blood getting to the skin and muscle, and without a regular blood supply to the skin and muscle, it can begin to die, resulting in a pressure ulcer. The red spots on this diagram show the most at risk areas of the body when laying on your back. This can be the back of your head, your shoulder blade, your spine, your sacrum, which is obviously the very bottom of your back, your buttocks, your heels, and also your toes. And the toes can be at risk because of the sheets they can cause pressure on the toes, and often pressure ulcers can develop in this area. This diagram here shows the areas most at risk when you lay on your side. So this can be your shoulder, your ear, your elbow, your hip, your knee, which can be the inner and outer aspect of your knee, your heel, and also the inner and outer aspect of your ankle. And lastly, these are the areas most at risk when sitting. So these can be the back of your head, your shoulder blade, your spine, your elbow, sacrum, buttocks, the widest part of your thigh if these are next to the side of the chairs, or if you're in a wheelchair, for example, the back of the knee, the heel, and also between the knees. It's important to look out for any skin changes. This can be discoloured skin, soreness and pain, particularly in areas where your bones are close to the skin, so like I've already mentioned, such as your bottom, your hips and your heels. And look specifically for persistent red patches on lighter skin that do not turn white when pressed, or purplish or bluish patches on all types of skin tones. Any localised swelling, blisters, shiny patches, warm or cool and or firm patches compared to surrounding skin, pain and discomfort, and any breaks to the skin or any wounds or any skin loss. The good news is that with the right care and equipment in place, most pressure ulcers can be prevented. It is important that you do not rely solely on nursing staff and or equipment to prevent you from getting a pressure ulcer. So it's always a good idea to do as much as you can to help reduce the risk of developing one of these wounds. Move and change position regularly. We normally say every 2 to 4 hours where possible, and this is whilst you're seated or in bed. Reduce or relieve pressure from the bony areas of the body by using specialist equipment and or changing your position. Eat a healthy, well-balanced diet and drink plenty of fluids, and check your skin regularly for any changes, and also keep your skin clean and dry. And further information about how you can help can be found in the leaflet. Reducing or relieving pressure to the skin is one of the best ways to prevent pressure ulcers developing. Moving and changing position lets your blood flow to all areas of the skin and reduces the chance of a pressure ulcer developing. If you're unable to change position on your own, you will need help with this from caregivers and nursing staff. If you do have a healthcare professional involved in your care, they can advise you on correct sitting and lying position to minimise the pressure on your skin, and how to adjust sitting and lying positions and how often you would need to move or be repositioned. They can advise you on keeping good posture and also on which pressure relieving equipment should be used and how to use it. Specialist pressure relieving equipment such as mattresses and cushions may be a necessary part of your care, so it's important that you're given the right type of equipment to suit your needs. Specialist equipment can include foam mattresses, alternating pressure air mattresses, which is an electric mattress that needs plugging in. It may be in the form of a seat cushion, and there are specialist equipment to help relieve pressure from the heels. However, pressure relieving equipment will not totally eliminate the risk of developing a pressure ulcer, so it's essential that you continue to move and change position regularly, even with the correct equipment in place. A pressure ulcer can develop quickly. Sometimes it only takes a few hours of remaining in one position. So it's important obviously to spot early signs of pressure damage and pressure ulcer development. You and your carer should undertake regular skin inspection on the bony areas of the body, like we've mentioned before: bottom, hips, heels, spine. And using a handheld or compact mirror, like you can see in the photographs here, may help you see areas that are difficult to check, such as heels. It's important that you look after your skin, so keep your skin clean and dry. Avoid alkaline soaps and cleansers as they can dry out the skin. Dry your skin gently and thoroughly pat dry instead of rubbing your skin dry. And moisturise your skin. Moisturise dry skin. Being incontinent increases the chances of developing a pressure ulcer. If not properly cleaned, the skin can become damaged and start to break down. barrier creams and products that help to protect the skin when wet may be used, but it's important to contact your local healthcare professional for advice on how to manage or treat incontinence. And we all have to remember that prevention is better than cure. However, if you do develop a pressure ulcer, please report your concerns to the person in charge of your care or local healthcare professional. You may need to see a specialist wound care nurse, often known as a tissue viability nurse. Tissue viability nurses specialise in all types of wounds, and they will have lots of experience of dealing with pressure ulcers. If you have any concerns or specific questions about your personal circumstances, please seek advice from your local healthcare professional and or the team in charge of your care. Within the leaflet there are some useful links to signpost you to specific websites that will give you further information around pressure ulcer prevention and also the management of pressure ulcers. So please visit the Tally website to download your copy of this leaflet. Thanks for listening. I hope you found this information useful.